On this Tuesday night, new information about vaccines and very rare blood clots. Canada reports its first case of a blood clot after the AstraZeneca vaccine as the U.S. suspends the use of the Johnson & Johnson shot.
This is a really rare event.
What's being investigated and what you need to know. Will the deal to save Air Canada fly?
There will be no further job losses.
What the airline is agreeing to do and the impact on taxpayers. Galen Weston Sr., the billionaire Canadian who built a retailing empire, has died. The mark he left on business and philanthropy. And Tall Order, rescuing endangered giraffes from rising floodwaters.
Global National with Donna Friesen.
Good evening and thanks for joining us. At a time when the vaccine rollout really needs to ramp up, there is more news tonight about very rare cases of blood clots involving two vaccines. Federal authorities in the U.S. are recommending states stop using the Johnson & Johnson vaccine because 6 women developed serious blood clots after getting the shot and one of them died. To put that into perspective, more than 6.8 million people in the U.S. have already received the single-dose Johnson & Johnson vaccine. Health Canada has approved the Johnson & Johnson vaccine for use here, but the first doses aren't expected to arrive until the end of April. It says it is watching developments in the U.S. closely. Canada pre-ordered 10 million Johnson & Johnson doses and has the option to buy 28 million more. Today, Prime Minister Justin Trudeau tried to reassure Canadians about the vaccine rollout.
And even without the Johnson & Johnson vaccine, we are going to be receiving over 44 million doses by the end of June.
The other development involves the AstraZeneca vaccine. It has been linked to blood clots in Europe. And today we got the first report of a person developing a blood clot here in Canada. We will get to more on that in just a moment. But we begin with what we know about the Johnson & Johnson vaccine pause in the U.S. Jackson Proskow has our top story tonight.
It was a 1 in a million reaction that raised alarm.
We are totally aware that this is a very rare event. We want to get this worked out as quickly as we possibly can.
Offering up a dose of caution, the FDA and CDC recommended pausing use of the Johnson & Johnson vaccine while they investigate. Symptoms appeared within 2 weeks of vaccination, all in women aged 18 to 48. 1 died, 1 is in critical condition. The FDA says it's similar to the rare reactions reported with the AstraZeneca vaccine caused by an unusual immune system response.
If it turns out that there's a certain population that should not be receiving this, or maybe there's some sort of medication that people should not mix with the vaccine, all of that needs to be figured out now to protect people.
The pause gives time to determine if there's a problem. It's also a warning to doctors. If recently vaccinated patients develop symptoms like intense headaches or abdominal pain, they should avoid certain treatments for blood clots.
That would be a mistake in this situation because it could be dangerous and make the situation much worse.
Merci.
As a precaution, Johnson & Johnson says it will now delay rollout of its vaccine in Europe. Within hours, J&J shots were pulled from vaccination sites across the U.S., in many cases replaced with Pfizer or Moderna, in a country where supplies are ample.
We have plenty of supply to continue our vaccination program and to hit our goals.
The worry is the pause will lead to a rise in vaccine hesitancy at a time when COVID cases are surging around the world.
The risk of the virus is much worse than the risk of the vaccine.
The vaccine has not been formally pulled from the U.S. market, and this pause may only last a few days. An expert advisory panel will convene on Wednesday to review the blood clot cases and determine just how significant they are. Donna?
All right, Jackson Proskow in Washington, thank you. Now, more on that first report in Canada about a blood clot linked to the AstraZeneca vaccine. Little detail has been released. We know it is a woman in Quebec who was vaccinated with a dose of AstraZeneca produced by the Serum Institute of India. It's known as Covishield. The Public Health Agency of Canada says the woman experienced a very rare adverse reaction and is now at home recovering. Her life is not in danger. 500,000 doses of the AstraZeneca Covishield vaccine have been distributed across Canada. Another 1.5 million doses are expected by mid-May. Vaccines are the way out of the pandemic, and millions of Canadians are anxious to get them, but these rare cases of blood clots do raise questions. An Ipsos poll for Global News found 64% of people say the type of vaccine they are offered will affect whether they get it, and 82% agree they should be able to choose which vaccine they receive. That contradicts the official advice that you take whatever vaccine you are offered. Abigail Bimman looks at vaccine hesitancy and what's being done to combat it.
It's been really scary. It's been really confusing.
Blood clot expert Dr. Manika Pai knows her patients and many Canadians have questions about vaccines and blood clots. She says everyone should still take the first vaccine they're offered, and she tells that to her own patients.
People who have a history of blood clots are likely not at an increased risk of this rare event, but they certainly are at an increased risk of adverse events from a COVID-19 infection.
Pai wants people to know the vaccine safety system is working and doctors are ready to help.
We feel confident that we can diagnose and treat it. So even though the information is changing rapidly, we are here and we're ready to protect you.
People may be tempted to wait longer to get vaccinated, hoping they don't get AstraZeneca or, when it's available here, Johnson & Johnson.
There's a real danger if you wait for 2 days in Toronto, for example, then you've automatically exposed yourself to a risk of death from COVID that exceeds this very rare risk of a blood clot.
Whichever vaccine you are offered is going to be the right one for you.
I think we can definitely be doing a far better job.
Scientist and science communicator Krishana Sankar says the desire to shop around for vaccines comes from fear.
Instead of, making people feel panicked and fearful, we really need to go in with being empathetic, number one, so that we show that, yes, we do indeed understand that there are safety concerns. But number two, we really share and look at the data.
Canada's top doctor acknowledges many Canadians have questions. The government is trying to provide healthcare workers the tools to answer them.
There is more to be done, whether it's through social media and other channels, to reach the younger age groups.
Vaccine hesitancy is often on the agenda in talks between the Prime Minister and the provinces, but with a second vaccine flagged for rare clotting concerns comes a bigger public relations challenge. Abigail Bimman, Global News, Ottawa.
For most people, the idea of air travel is a distant memory, and airlines are bleeding money. Over 40 commercial airlines around the world have gone bankrupt in the pandemic. Now the federal government has stepped in with financial support for Air Canada. It is $4 billion in repayable loans, plus $1.4 billion to pay refunds to customers who had their Air Canada flights canceled because of the pandemic. The government is also buying an equity stake in the airline. There are conditions about protecting jobs and resuming some regional routes. The wild card is what happens with air travel in the months and years ahead. Mike Armstrong explains.
It was news some were desperately waiting to hear. People who forked out hundreds or even thousands of dollars for trips on Air Canada only to have them canceled. Samantha Kemp has been fighting to have a flight reimbursed for months.
The fact that it took the government to step in and also took the government this long is kind of ridiculous to me.
There will be no further job losses.
The deal gives Air Canada access to about $5.9 billion, most of it in low-interest loans. About a quarter of it is supposed to target reimbursements. Now, giving that money back to consumers would have been a challenge for a company that's burning through reserves, has laid off more than 20,000 workers, and canceled about 95% of flights.
It's a couple $2 billion. The
reimbursements, this airline expert says, may not have happened without Ottawa's help and pressure.
The optics are very positive about paying the money back, and the government gets a lot of brownie points because they're the ones that, in effect, forced them to do it, but also provided the means to be able to do it.
Now, there is one part of the deal that has surprised some observers. Ottawa is buying shares in Air Canada, about 6% equity. One reason to do that may be the potential return if airline stocks rebound post-pandemic.
Then the Canadian government can rightly crow about the fact is that they made a wise investment, and not only did they get the loan money back, but they actually made money on it.
Under the deal, Air Canada also agrees to restore regional routes it suspended. Flights to places like Comox, BC, and Sydney, Nova Scotia have to be back up by June 1st. The deal also limits what Air Canada executives can make. The company's last CEO took home more than $11 million pre-pandemic. That isn't supposed to happen again for a while.
Executive compensation is restricted under the terms of this agreement. There is a cap of $1 million. Total compensation.
The big question now is what happens to the other Canadian airlines. WestJet and Air Transat are both in negotiations. Observers expect those deals could come soon, with the Air Canada arrangement acting as a template. Mike Armstrong, Global News, Montreal.
With me is our senior business correspondent, Anne Gaviola. Anne, all the airlines are asking for help. Why Air Canada first?
Well, it is the most international, in addition to being the largest airline that we have here in Canada. And by that, I mean that its rivals, which are based in the US and Europe, have already seen targeted funds, targeted relief from their federal government. So this is kind of an attempt to level that playing field, if you will. It's also an opportunity to give Air Canada a chance to protect, to keep its spots in international hubs, those spots that it has in airports in other countries that are important for connections. And a lot of those airports have policies where if you're not operating out of them, you lose your spot. And there are plenty of low-cost regional carriers that are willing to jump in and get in there. That's going to be important for Air Canada to keep its competitive edge as we get to the other side of this.
This is a repayable loan, not a bailout per se. What's the likelihood the billions of taxpayers' dollars will be paid back, and when?
That's a really good question. Now, according to the analysts I've spoken with today, they tell me that the chances of Air Canada repaying this money is actually quite good. And keep in mind the way that this deal has been crafted, there are strings attached. There are limits in terms of caps on executive compensation. There are restrictions on share buybacks. There's even that environmental reporting piece of it. So these are strings attached that have been described as pretty onerous. What we've seen in the U.S. is that there has been a reluctance from airlines to take government money that it doesn't need because they don't want to deal with any of those conditions, and it really does incentivize them to repay that money back more quickly.
All right, our senior business correspondent, Anne Gaviola in Toronto. Thanks. A Canadian billionaire and entrepreneur who built the family business into a food and retailing empire has died. His family says Galen Weston Sr. died peacefully at his home on Monday after a long illness. The patriarch of the Weston Empire, he took over and turned around Loblaws and went on to acquire multiple businesses, including Holt Renfrew and Selfridges Group. He was also a philanthropist who donated to a range of organizations across Canada. Weston is being remembered as a beloved husband, a proud father, and a loving brother. He was married to former Ontario Lieutenant Governor Hilary Weston for 55 years. They raised 2 children. His son Galen Jr., now CEO of both Loblaws and George Weston Company, says his father's greatest gift was inspiring others to achieve more than they thought possible. Galen Weston Sr. was 80 years old. Big cuts at a Canadian university coming up. Dozens of layoffs and programs lost. Will it save the school? We think of universities as pillars of higher learning that, once established, just keep going strong. But what's happened at Laurentian University in Sudbury, Ontario, has shaken that idea to the core. Yesterday, dozens of professors were fired and multiple undergrad and graduate programs were cut. Eric Sorensen explains why and what a shudder it has sent through other universities.
The deserted campus and the empty classrooms, a consequence of the pandemic at post-secondary schools everywhere, tells only part of the story at one university in Northern Ontario. Laurentian hit such dire financial straits that 2 months ago it became the first university in the country ever to seek creditor protection from the courts. Now it is shutting down programs and laying off professors like Nadia Varelli, who says she was blindsided political science was cut.
Only because political science is one of the oldest disciplines in the social sciences, so there's a lot of confusion, of anger, and a lot of hurt.
In all, 69 programs, including 1/3 of undergraduate programs, are being closed, from music to environmental studies. 34 English language programs are out, as well as 24 French language programs, and 11 graduate programs for master's degrees are being discontinued. Caitlin Kotola has been a student for 4 years.
It's a heartbreaking heartbreaking announcement when you're told that something that you've worked so hard for is being ripped away from you at no fault of your own.
Laurentian is bilingual, with emphasis on French language and Indigenous studies, as well as English, and represents a beacon of higher education in one of the northern, less populated regions of the country.
Businesses will close, people's plans for education in Northern Ontario will be disrupted.
The Ontario government defended its policies but would say little else as Laurentian goes through creditor protection.
This government remains resolute in ensuring pathways to graduation for all students.
One reason all universities are hurting is a reliance on foreign students who pay much higher tuition costs but have stayed home during the pandemic.
This government has decided to prioritize using international students essentially as cash cows to uphold its entire post-secondary education system. Since 2018, we've seen a steady decrease in public funding for these institutions, and that is what we need to focus on.
It is all provincial jurisdiction, but the Prime Minister says Ottawa will weigh in with Ontario to see what can be done, particularly at a bilingual institution with a focus on minority communities. Eric Sorensen, Global News, Toronto.
Toronto's interim police chief has apologized to the city's LGBTQ2 community. An independent review found systemic discrimination was a factor in the force's handling of several missing persons cases. The review called for truly transformative change in the force. It was ordered after the arrest of Bruce MacArthur, who pleaded guilty to murdering 8 men who had gone missing. All had connections to the city's gay village. The report found some officers had misconceptions or stereotypical ideas that impeded their work. Chief James Raymer says Toronto Police will act on all 151 recommendations.
None of this is acceptable. None of this should have happened. As we all know, tragically, lives were lost. To the family, friends, and community members left behind, we apologize. You deserved better, and we deeply regret the impact our actions and inactions had and continue to have on your lives.
The chief says Toronto Police will double the number of missing persons investigators. He says the department is exploring how to integrate civilian support workers into the missing persons unit. More anger over the shooting of Dante Wright ahead, the resignations from the police force.
You're watching Global National.
Hundreds of protesters defied a dusk-to-dawn curfew in Brooklyn Center, Minnesota overnight, angry about the police shooting of an unarmed black man during a traffic stop. The white officer who shot 20-year-old Dante Wright and the police chief both resigned today. The chief has said the officer, Kim Potter, mistakenly grabbed her gun instead of her taser. Today, Wright's mother revealed the last time she saw her son was shortly after he was shot, when the woman in the car with him picked up his phone.
Then she pointed the phone towards the driver's seat and my son was laying there, unresponsive.
My Lord.
That was the last time that I seen my son. That's the last time I heard from my son, and I have had no explanation since then.
Next, what a new study reveals about suicide risks during the pandemic. You've never had to think, probably, about how you'd rescue a giraffe. Well, this is how. This calf was the last of 9 giraffes stranded on an island in Kenya. Rising lake waters repeatedly flooded their habitat. They're a highly endangered subspecies called Rothschild's giraffes, and it took 15 months to plan how to tranquilize, blindfold, and ferry them off the island to a nearby sanctuary. That custom-built barge, by the way, is called a G-raft. Well, we're all living through tough times right now. COVID-19 has taken a tremendous toll. Drug overdose deaths have increased, as has demand for mental health support. But an international study found no increase in suicides, at least in the first months of the pandemic. Heather Urix-West explores the possible reasons why and what it means for the road ahead.
Last June, when the world was in the grip of COVID-19's first wave, Andrea Gordon lost her partner David to suicide.
David felt very isolated. He was a very social person, and he really missed his friends and his family, and the ability to go out and work full time. All of that was curtailed for him. All of that was adding to his anxiety and adding to his worries about the future.
Gordon doesn't know if the pandemic was entirely to blame for her partner's death, but she believes it had an impact, though a new international study published in the Lancet Psychiatry has found that at least in the first months of COVID-19, in many parts of the world, suicide rates did not rise. The research tracked the number of suicides in 21 countries, including Canada, between April 1st and July 31st, 2020. It found no evidence the pandemic caused an increased risk of suicide. In fact, in 12 areas, including BC and Alberta, suicide rates actually declined.
There was a 24% reduction in suicides in British Columbia and a 20% reduction in Alberta.
But just because suicide rates did not increase in the early days of COVID-19 doesn't mean we're out of the woods yet. For many people, stress levels increase the longer this pandemic drags on. And there will also be long-term mental health impacts to consider, particularly for healthcare workers who will likely deal with post-traumatic stress long after COVID-19 is resolved.
Suicide is often a lagging indicator. So when something awful happens, we don't typically see suicide go up. We often see a coming together effect. But as time goes on and people exhaust their personal resources, life can become more and more bleak.
I sat on the advisory committee for that.
It's why Andrea Gordon is now working as a suicide prevention advocate, sharing her partner's story in the hopes other lives can be saved. Heather Urex-West, Global News, Calgary.
If you or someone you know needs support, there is help, including through Crisis Services Canada. You can call 1-833-456-4566 or text 45645. That is Global National for this Tuesday. I'm Donna Friesen. Tonight's Your Canada is the now COVID-compliant lunch break sculpture in downtown Edmonton. Thanks for watching. Hope to see you here again tomorrow. Take care of yourselves. Bye-bye.